So, good morning, everybody. This is my introduction. I'm David Kidney. I'm called the Executive Chair of the cluster, and I want to make a presentation about where we've got to. I'm not sure if anybody on the line joined us in the autumn when we did autumn spring shows. That was about investigating whether we should set up a cluster. Today I'm going to tell you that we have set up a cluster and how we hope it's going to go. So we've got the cluster set up. It's a limited company, limited by guarantee. It's a not-for-profit company, that's in the constitution. So any profits are retained for the benefit of the cluster. We've got a proper kind of board and policies and so on. We've got our proper communications with a website and email address, and we're active on Twitter, mainly thanks to Ravi, but sometimes I join in as well. So we've kind of gone from when I was appointed last March to find out, is there a case for a cluster, to just 12 months later, actually setting up the cluster. And I think that's quite a good kind of progress from standing start. So there is detail now about how we're going to be structured. Fundamentally, we're a membership organisation, and the members that we want to attract are the businesses that are active in health technologies, and the organisations that support them, like universities with research and support, the ProfTech services that they draw on, and the big customers like the hospital trusts and so on. And we've set some membership fees for our first year. So a micro company that's under 10 employees, a fee of just under £250. Most of the health tech businesses in the West Midlands are SMEs, that's for sure. And we set just under £500 as the fee for them. And for a large company, that's over 250 employees and just under £750. So we did our research about these fees last year, and we thought those were quite comparable with other kinds of organisations in the same sector in other parts of the country. And so far, I mean, we're not up and running until the 1st of April, but we've invited people from February to say that they will join. And we have got joiners in each of those three categories already. What we've said for the micro business, where every pound of spend matters and they need to be convinced they'll get something for it. We've said that in year one they can join for free and actually get the experience and judge whether it's a benefit to them. And we'd expect them to pay in the years after that. And as part of our effort for inward investment into the West Midlands, we've said that if companies are relocating into the region, one of the offers that the people welcoming them can make to them to tempt them to join, I'm sure it's not the deciding factor on its own, but they can have free membership, whatever their size, of our cluster for their first year when they get here, which instantly gives them networks and people to learn, get to know. But when we did our studies last year, we came to the conclusion that if we tried to do all the ambitious things we want to do as an organisation and rely only on membership fees to pay for them, there's going to be a shortfall. And we are very ambitious, and we don't want to pare back the services. We want to ramp up the income to pay for the services. So we came up with two other ways that people and organisations can be involved with us. The first of these is a strategic partner, and the second is as a sponsor. And for us, what we mean by a strategic partner, this is somebody who's willing to contribute cash and contribute in kind to joining us to jointly lead an area of activity during the year. So everything would be badged jointly. The strategic partner would provide speakers, ideas for events, and help us organise events, whether virtual or later in the year, hopefully in person. And we kind of work together on projects. And we're hoping that in total, the in-kind and the money will be £10,000 per organisation. We've already got, I think, 4 or 5 organisations that have expressed a willingness to be strategic partners, which is very helpful to us. We do, like anybody else, really recognise that sponsorship could be an important source of income. We do feel that we'll have an ethical background to who we accept as a sponsor. So people that we thought weren't very attractive, people like the gambling industry, we wouldn't want to be sponsored by them. But otherwise, we're willing to talk to people about sponsorship that meets a need that's important to them, and that's why they're willing to hand over money, but also important to us in terms of our priorities. So a couple of examples I've given here are annual awards. If we wanted to raise the profile of the sector, both in the region and beyond the region, we might want to institute a series of annual awards going forward to draw attention to the successes. And it would be good if there was a sponsor who wanted to pay for the infrastructure for arranging annual awards and have their name associated with them. And the other example I've got is a research programme about the health technology sector in the West Midlands. Because one of the things we found last year when we were researching this is that the statistics might look good on paper, that there's 8,000 companies in health technologies, for example, but when you get the list and you go through it, a lot of them are very much not really health technologies, or they're redundant and the information's out of date. And anyway, there's no detail behind the list. So we don't know what kind of businesses they are. We don't know what their size is. We don't know what their ambition is. We don't know what are the obstacles that they need to overcome to grow. And we need that data, I think, as a region, not just for the cluster. And I would very much like to find a sponsor who wanted to be associated with an ongoing research program that repeats every year and builds up a really strong understanding of our sector and what its needs are for support. But I also recognise that sponsors would have their own agendas and their own ideas, and we talk to them subject, as I say, to our ethical values. So we're hoping to be up and running 1st of April, and we've got some ideas about the things we want to aim for. So first of all, we do want to stress that we're a business-led organisation. So we want to attract businesses into membership. And those businesses, we describe them in the widest terms possible for their health technology contribution. So for example, a hospital trust that invests massively in health technologies, in our view, is a health technologies business. An advisor who advises on intellectual property for inventions and ideas is, if it's in the health technology sector, we regard that as a health technologies business. And over time, we've come to find that there are kind of 4 Ds that describe the kind of businesses we're interested in. So medical devices, digital health, diagnostics, and overarching all of those 3, data. So anybody who's engaged in those 4 Ds, we're interested. So we want them to join, want them to be strategic partners. Some of them, we want their leaders to be our leaders and join us on our board. And we are having some success in our talks with major organisations in the region who want to be in both of those positions with us. And we do want to stress these important links between businesses and universities. I mean, in a way, universities fuel the businesses of health technologies. And we want that fuel supply to be strong and to available everywhere in the region for businesses wherever they're located. So we do want to have good relations with universities to spot the opportunities for joint bids for funding, for joint opportunities to grow new businesses, and all reminding ourselves that we're going to do this in order to improve the economy of the West Midlands and the skilled jobs in the West Midlands for our residents. And in that vein, the third of our kind of early opportunities is to promote the region nationally and internationally. So we want to be a team player with all the other organisations who feel it's their job to promote the region. Try to agree joint messaging, because I think in the past you'll agree that sometimes people have done their own thing, cut across each other, have been inconsistent, sometimes undermined other people's efforts. And we need all to be pulling together as a team. And we have had an early opportunity to show our kind of willingness to do this, in that some of you may know about the PPE Collective in the West Midlands that set 5 companies from areas outside of health who set up a joint attempt to meet the urgent need for PPE last summer in answer to the government's call to arms. And they completely ramped up their businesses and even took on new employees to supply the University Hospital Birmingham. And then the government changed back the procurement rules so they couldn't supply any. And the mayor of the West Midlands Combined Authority, several other organisations took up the issue on behalf of the 5 companies with government. It didn't make an awful lot of progress. And now the mayoral election is on us. The mayor's office can't continue the lobbying. So we were asked if we would take over the lobbying on behalf of the 5 companies. And we've done a major briefing that we've sent to government ministers, to MPs in the constituencies where the 5 businesses are, and to the leaders of councils in the 5 areas. And our plan is to broaden that briefing to all MPs and all leaders of councils in the West Midlands to try to get everybody on board. And the point about the briefing is, yes, to try to stick up 5 companies with what they originally set up to do, but also to try to encourage them and procurers to take further the innovation that they displayed into more areas of health, and kind of hanging our argument on that hook, support the PPE collective. We're trying to widen it out to say, well, what about a partnership with government and ourselves in health technologies in the region to try to showcase the best of health technologies in the country. And we're looking forward to seeing if ministers will pick us up on that and run with it and meet us to talk about it. But again, we're not open yet. We're not open until the 1st of April, and yet this slide is a list of things we've already done, which I think is really quite impressive. So, for example, people at the Growth Company, the Growth Hubs in the Birmingham area, had the idea of lobbying the Department of International Trade for us to be recognised in what they call the Greater Birmingham West Midlands area, recognised for our health technology strengths as a high potential opportunities area of the country for health technologies. And the plan is that this builds a prospectus for high potential opportunities, which goes out to all our embassies around the world, and enabling the trade missions there to sell the attractions of health technologies investments in the West Midlands. And so we've taken full part in the discussions with the Department of International Trade, developing the prospectus, and it's very satisfying to see in the 2nd iteration of the prospectus that the technology cluster is there in the midst of the services that are offered for people who want to come into the region, and a new idea that I'd like to come back to in a moment about a concierge service is also there that we have championed. So I'll come back to that in a moment. We've also been supporting a project led by the GBS Lab about support for supply chains. I mean, as many people will know, because of COVID-19, all those people who more and more put all their eggs in one basket of supply from, let's say, China as an example, have found that their supplies have been disrupted during the coronavirus pandemic, partly because priorities in China have changed and so people can't meet their original deadlines, partly because international transport has been affected as well, including added here with Brexit, the ships couldn't get into harbour as quickly as they used to. So people have started to realise that there's more to supply chains than cheapness and a just-in-time that might not be just-in-time when you're relying on it. And so people are looking at diverse and resilient supply chains, and often that does mean local supply chains. So the question is, can we persuade more companies to reshore their supply chains back into the West Midlands region, closer to the businesses that they supply? And we're supporting that project at the moment. And out of that, my 3rd bullet point, came an idea of a mini cluster within the cluster for small diagnostics businesses that want to become big diagnostics businesses in the future. And we've now got a project that we're going to be managing from the 1st of April to support a small number of diagnostics companies with advice, with mentoring, and access to laboratory space, clean space for their activities, to try to grow them during a year, and then look back at the end of the year and evaluate whether that's a good way of proceeding. If so, maybe a transferable one to mini clusters in other areas of those 4Ds. And lastly on this slide, we've been asked to be the host for the Innovation Advisor for the Health Technology sector. This is part of a project by Innovation Alliance to have a virtual innovation team with the innovators who can give advice, specialist advice in particular sectors. So for example, in automotive and in the creative sector, we're going to be the home for the one in the health technology sector. So again, from a standing start last March and not even opening our doors yet, it's pretty impressive. Those things have already been achieved. So when we've got members and they're paying money and expecting services in return for their money, here's some of the things that we expect to be lining up with our members. And we will do it jointly with them. We won't kind of impose this from above. But we know that networking is very important to them, both within the sector but also looking outwardly towards suppliers and commissions of services and so on. And so we want to be able to arrange that networking for them, specifically to meet buyers, people who have got contracts to let, the people who procure services on behalf of the public sector, other businesses that are big buyers. We want them to be able to meet and discuss what they've got to offer. And the same way that the people who finance or invest in or supply businesses, we want them to be able to meet them. And an idea that we want is behind a kind of the paywall for our members on our website. We want a section where the members will be able to share their ideas and swap good practice stories and ask who's solved the problem that somebody's come up with, so they don't have to reinvent the wheel. And we've promised that we will help with accessing support services for their businesses. And in return to that, we've promised that we will share our news, that we'll try to bring more coherence to the support that's available to the sector, and be a powerful advocate for the sector. And it's there in that coherence that I just want to go back to the concierge service, because there's no doubt there are good services to businesses right across the region. Their geography is sometimes limited to boundaries that are only a part of the region, which is part of the problem. But also there's more than one organisation. And inevitably that means that leads to duplication in some areas and gaps in others. And our mission really is to try to join together the services so that we bring coherence. And we're thinking a concierge service where each person who's got an inquiry, whether in the region, let's say a small company that wants to get bigger, or out of the region, let's say somebody who wants to relocate here or invest here, whenever they make that first contact with anybody in the system, anywhere in the West Midlands, we all get to hear about it. They get a treatment that's the same every time, whoever is the provider of it, in terms of the support, via a protocol that we all sign up to. And we see the cluster as being the holder of the data, so that we can check that everybody has had the service that they were expecting to receive. And we'd be the judge and overseer of the quality assurance of that, and that we'd be able to report in terms of transparency and whether this is effective or not each year as to how people's responses were managed and whether everybody was satisfied with the service they got, which would be like surveying them afterwards. And I think that could be a very powerful tool to getting us all onto the same page and improving our performance looking out at the rest of the world. So I just want to say we're kind of now at crunch time. We're going to open our doors. We're going to expect businesses to sign up and pay money to us. We want the strategic partners we're talking to sign up and hand over their money, start joining us in planning the activities for the next 12 months that they will lead on for us. And hopefully then the business plan that I spent last year drawing up becomes reality in the sense that we've got the right amount of income to provide the full range of services that we're ambitious to give in the region. And so, you know, for the people on this call, if you're a business thinking about, or an organization thinking about whether this is something to join, please do consider joining. And if you are not in that position, but you are in a position of influence and you know others who might benefit from being joined with us, please go away and talk to them about us and point them in our direction, and we'd be happy to take over the talks with them. It is crucial now that we survive, but financially, otherwise we won't be around for long. But with our plans, you know, we are sure that we can make a difference for the better in the region. I've got a slide with my contact details, which Ravi will send around to everybody afterwards anyway. So don't worry about taking the details now, but you're very welcome to contact me by any of those contact details if you want.